Well, good morning. Now, there's not a lot of stretches in the traditional sense of the term that I tend to advise the older person. I prefer to show the older person ways of gentler movement just within the resistance or pain that they might have, and do them in a repetitive and slow and rhythmic fashion, and that tends to improve the elasticity as well as encourage the actual training of the movement through the nervous system. However, one of the stretches that I do often recommend, because of the preponderance of a type of sciatica or referred pain of a similar nature in the middle-aged and older person, is the piriformis stretch. And so I'm just going to show you a simple piriformis hip stretch, which I think not only releases the piriformis, but actually releases the lumbar spine musculature as well. And often I'll see an improvement in the quality of lumbar spine, ranging especially flexion, following someone doing a number of the piriformis stretch. So here's how it goes. You're just lying flat on your back. Get nice and comfortable. Legs out straight. And then you're going to take one knee bent and up, and you're going to hold that knee with the hand on the same side. You can then draw the knee in a little and reach with your opposite hand across to the shin. That way you can do a little bit of rotation on the leg. And once you're there, you can then draw both hands. Now imagine that you're going to draw both hands towards the opposite shoulder. So from there, you're just drawing both hands towards that shoulder. And again, I prefer if people do not do painful stretching, and that you just meet the first resistances of stretch. Now, there are some caveats that need to be Now, there are some additional comments to be made. The stretching sensation needs to be at the back of the hip buttock area. If there is a discomfort in the groin, it's a sign of hip impingement or impingement on other soft tissue in front of the hip, and it is often going to be a problem for you if you pull in on that discomfort in a forceful manner. My advice is, if that is where you're getting the resistance, to back off until you don't feel or barely feel that resistance. In fact, if that is where the resistance is for you in this type of exercise, you will need to perform a different type of exercise and not focus on the piriformis at all. Now, and I'm just going to change legs to show you the other way, and we'll talk about how long you hold the stretch. So you're going to bend the knee up, lift it up, just take your hand on the same side to your knee, your opposite hand to the shin, give a little rotation, and draw out both hands as if you're coming to the opposite shoulder. Just get a little tension through the back of the buttock. Going to hold that. It's possible, if someone does have a sciatic problem, that they might get actually leg pain or discomfort or even some tingling from that. So back off. You don't want to exert forces on the sciatic nerve. Whether or not those sensations are coming from the sciatic nerve, it is good caution to just back off. However, if it's only a tension up through the buttock, you can then hold that stretch, and I usually advise a simple 10-second hold. and that's a slow count. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. And then you can put that leg down. So then what I would recommend is to do each leg alternatively up to 10 times. So again, it would just be bending the knee, lifting the knee, same side hand on the knee, opposite hand on the shin, drawing up and count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if you are getting a groin type of pain or resistance, if it's only when you're doing this type of exercise, there may really not be anything to get too anxious about. If you are getting groin pain on a daily basis and it's troubling you in your function, then that's worthwhile getting checked out with your local physiotherapist. The most common reason for anterior joint pain from a musculoskeletal point of view is wear and tear of the hip joint. Now, of course, if you've had an injury of some sort, fallen down or taken a heavy load, then you may be in danger of having damaged your cartilage structures, such as your hip labrum. In any case, if there is a little bit of discomfort, but it's not interfering with function so much, the movement training or movement exercise I would suggest that you do in that case is the same type of positioning. And this time though, you would just do a repetitive movement. And I'll show you this. You might even take both hands to your knee and you can feel where that groin pain occurs. Does it occur when you pull it straight up? Does it occur when you pull it over to the side or even straight over to the side? Or is there a little bit of an area which has a few positions in it? And what you can try with this is just to pull the knee into the pain and then let it go out of the pain. Not hard into the pain, just to the edge of the pain and out. And you can do that 30 times. If there are a few positions that hurt, then you can use 10 times for each position. What you can do is even come back to this, if you're symptomatic, a couple of times a day and do that every day. You will be able to notice that either over the course of a week you will improve both your pain and the range of movement before you get the pain, or you will not. If it's a musculoskeletal problem, it's unlikely that if you're being cautious and only doing the movement to the edge of pain, that you will increase the pain. However, if you are finding that the pain is increasing by doing the exercise or simply not changing at all, that is a good indicator for you to get some personal face-to-face time with your physiotherapist. There are people who, if they have significant hip arthritis already, will not even be able to get to the 90-degree angle of their hip. So in that case, you can still do these types of exercises. However, you might need an assister like a towel that you put under the back of your leg to be able to do it, because you must always hold to the rule that you're only going to the first point of resistance or pain. Otherwise, you run the risk of simply aggravating painful condition, even some inflammatory responses. Okay, that'll be all for today. I'll see you soon.